Guys, today we are going to discuss about everything about vitamin A, like sources, what is the RDA, and WHO classification of vitamin A disorders, and what is hypervitaminosis. And okay, so first, vitamin A, which is also known as retinol, which is derived from carotenoids. Okay, which are present carotene, which is present in the plants, or carotenoids. So this vitamin A will be converting into retinol like that, and it will be stored in the liver in the form of retinol palmitate, means ester form. Okay, retinol palmitate. So this is important, and this will be converting into 11 cis retinol, okay, and this 11 cis retinol will be fused with the opsin or rhodopsin. Opsin is present in cones and rhodopsin is present in rods. Okay, like after that it will get isomerized into 11 trans retinol. 11 trans retinol will be bind to opsin. Okay, when this 11 cis retinol detaches from the opsin, then you will get this process known as bleaching. Again it will be converting into 11 cis retinol. Okay, this is like when this 11 cis retinol will be converting into 11 trans retinol, means on exposure to light. When eye is exposed to light, then 11 cis retinol will be converting into 11 trans retinol, and after that 11 trans retinol detaches from the opsin to become again 11 cis retinol. This is a cycle, right? Okay, this is just generally about vitamin A, what we had already learned before. So, what is the RDA now? So, in infants, for infants it is like 300 to 350 micrograms per day is the RDA, and per day. Okay, and for children, okay, for children it is 400 to 400 to 600 micrograms per day. And now for adults it is 750, 600 to 750 micrograms per day on an average. Okay, so these are the RDAs. You should be remembering these RDAs. Coming to next sources. What are the sources of vitamin A? Tell me the sources. Carrots, mainly plant sources like carrot and leafy vegetables like amaranth, spinach, like that, leafy veggies. And then even we have animal sources, just a brief, like egg, milk, cod liver oil, like these are just mango, even a source of vitamin A. Mango, okay. So this is, and then these are the sources. Then we'll go with, okay, disorders in vitamin A deficiency. If less than RDA, means 300 micrograms for infants, 400 to 450 for children, and 600 to 750 for adults. If in pregnancy, more recommended dose will be recommended. Okay, lactation even more. Okay, so disorders is xerophthalmia, night blindness, okay, color blindness, like these things you will be seeing, and cataract. Generally I am writing the things. And next we will see WHO classification, and you will see white hot spots. These white hot spots, keratomalacia, these are comes under like xerophthalmia only, white hots and keratomalacia. So let's discuss. And even vitamin A also, I forgotten what are the vitamin A functions. One is vision, another one is epithelial integrity, tissue growth, reproduction, like that. Okay. So in case of vitamin A deficiency, you will find dry skin also from this dry skin. And okay, so now we are going to discuss about WHO classification of vitamin A deficiency, and after this we will go to discuss about, we are going to discuss about the how much we will give for 6 months old baby, and less than 6 months, 6 months to 1 year, and greater than 1 year means up to 5 years. How much RDA will give, how much international units of vitamin A. So WHO classification: XN night blindness, X1B is white hots, X2 is corneal xerosis, X1A is conjunctival xerosis, and see, XN is night blindness, after that X1A is conjunctival xerosis, X2 X2 is corneal xerosis, X1B is white hots, X2A is corneal ulcer, X3A is corneal ulcer, okay, which is involving less than 1/3, and X3B is keratomalacia, which is involving greater than 1/3, and even we have 1/3 of the cornea, and even we have XF and XS. XF means fundal changes, XS means scarring. Okay, now and you have to remember that 30 milligrams of retinol is equals to 1 lakh international units of vitamin A. And even in immunization schedule, at 9 months along with the measles vaccine, you will give 1 lakh international units of vitamin A. And for like 18 months, 24 months, 36 months, like this you will give 2 lakh international units up to 5 years every 6 months. Okay, so and for infants less than 6 months, you will give 50,000 international units for infants completed. After that 6 months to 1 year, how much you will give? You will give 1 lakh international units. Okay, greater than means 1 year to 5 years, you will give 2 lakh international units. So you should be giving on 2 days, and again after 6 months. Okay, this should be continued. Then this is WHO classification we studied, and we studied the RDAs and how much. So in case of any emergencies, in case of emergency requirement of vitamin A, so to reduce the chance of going into any blindness or any vision problems, you should be giving 50,000 international units if the baby is less than 1 year, and 1 year to 5 years you should be giving 1 lakh international units of vitamin A, that is 15 to 30 mg of retinol you should be giving. So and up to now we had discussed this. So we have another criteria. See, we have another this thing which is known as pseudo tumor cerebri. In this patient will be complaining of increased vomitings, and he may complaining some rise in intracranial tension, along with if he is taking cod liver oil daily, then he may present with hypervitaminosis. In this condition there is hypervitaminosis will be present, pseudo tumor cerebri. Okay, so that is that. And again, pseudo tumor cerebri, hypervitaminosis if you are consuming greater than 10 micrograms per day daily. Hypervitaminosis in pregnancy greater than 3000 micrograms if you are consuming, then it is hypervitaminosis. Okay. So and we have another condition which is known as Kerotomia. In this condition what happens means yellowish pigmentation of the soles and palms will occur, but this yellow discoloration won't be affecting our sclera. Okay, sclera won't be involved. This if you discontinue eating carrots and other source of vitamin A for 2 to 6 weeks, sorry, not months, weeks, then your skin becomes normal. Okay, that's it guys, and thank you guys, thank you so much.